Hello lovelies, and welcome to today's video. My name's Alya and I'm so glad you stopped by. Today we are celebrating Orthoptics Awareness Week. So I'll be telling you about my experience and my journey in orthoptics. So I hope you stick around to hear all about it. Orthoptics is one of those professions where everyone sort of goes, oh, how did you hear about it? How did you get into it? Because so few people have even heard of orthoptics, let alone, chosen a career in it. And for me, it was actually really interesting because you would think it was a very easy decision, but it was not actually my first choice at all. So my granddad has had glaucoma. He had surgery for it, so he's now got other issues, ophthalmic issues down the line. He's got a very complicated eye story, and maybe I'll tell it one day as a video. But so I spent most of my adolescence accompanying him to appointments in the role of an interpreter. So whenever mum couldn't, I got sent in. So lucky for me, my dual language skills, my polyglot skills came in handy, and I was able to interpret for him with his ophthalmologists once I got a bit older. That definitely did give me my love for the clinic, so I definitely knew I was going to be a clinician of some sort. My grandma back in the day was a pathologist, which in Russia required her to be medical. So doctor, in a sense, a doctor of pathology. So, that she always had this idea that I was going to be a doctor too, which is lovely, except that to be a doctor you have to have what I call the glue on the bum skills. These are people who are able to sit and study and get the grades and do all that sort of thing. I never had that capability whatsoever. I'm very into learning. I love learning. I can get into something for hours, but there is no way as a teenager I had the ability to just sit and do the hours required to get the grades. Here in Australia, you have to get just about perfect score to get into medicine. Plus, you've got to go through a special exam. I couldn't even tell you what it's called right now off the top of my head. And then it's, 6 years of uni. At least that's what it was like when I graduated school. One of my closest friends in the whole wide world did medicine. She's amazing. She's so smart. I don't know how she did it, but she had, commitment. She had a dream. I don't know that I had a dream. I definitely wanted to be in the medical field. I don't know that I ever wanted to be a doctor or a surgeon. She's done so much research, my friend. She's just brilliant. The doctor I work for, the main doctor I work for, same thing. She's just so smart, and she was just so committed to the dream, and, the hours of commitment, and, it's just crazy. Like, it's just an amazing accomplishment. There's a sacrifice. You've got to then have a very, very high commitment job. You're committed to your patients, as well as being committed to your family, as well as being committed to having some sort of a personal life. I mean, it's the kind of career you've got to absolutely adore to do. And I don't think that I love it that much. I love eyes and I love being a clinician, but I also love that to some extent, to some very small extent, I do leave my work at work. Sometimes. Definitely more so than the doctors I work for, where, they definitely have to keep going even once I'm gone. So that's probably one of the reasons why orthoptics was very appealing, is that you definitely work as a duo, as a team with the doctor. A lot of people ask me why, if you like eyes so much, why not optometry? Honestly, I don't know. I don't know why I ended up going into orthoptics and not optometry. A lot of my friends that I studied with did then go on to do optometry. I definitely had the option later on in my career, my student career, to do optometry, but I don't know, I just really loved the purely clinical aspect of orthoptics, and that it didn't really require having a shop and having the business side of things and, the sale of glasses. I also don't really love contact lenses and the whole schmozzle of contact lenses. I just didn't enjoy it. And I really loved the whole surgical preparation aspect of orthoptics as well. And I think it was just a matter of being stubborn in a sense as well, and that I started orthoptics and I wanted to see it through. And as I learned more about it, I loved more about it. So that was really awesome too. The other really cool thing for me was that I got to go in my final year and practice as a student. We did a whole big block of clinical practice, and I did it in Queensland, where there is a huge shortage of orthoptists. So they actually train just biomedical students or health science students to be sort of ophthalmic technicians, I think they call them there. And they basically fulfill the role of an orthoptist up until it comes to pediatrics. Pediatrics is still done by the classical orthoptist, classically trained orthoptist, but just about everything else where there's imaging and diagnostics and measurements and whatever, that's done by people who are trained on the job, which is a huge commitment by the clinic to train these people. You know, obviously having someone that's trained through uni, through the degree, is better, but they don't really have a choice. Here in Melbourne, you get orthoptists doing orthoptic work, which is fabulous. And in Queensland, I got to see everything from surgery, retinal surgery, cataract surgery, laser surgery, any surgery you can imagine. I saw it. I got to see a lot of refractive stuff done, so a lot of pre and post care for laser and cataract and things like that. And I got to work a lot with pediatrics, so I got to do a lot of the classic orthoptics, and I learned very quickly that that was not for me. It was just, even in the private sector, it was very, very demanding emotionally, and I knew that it's just not for me. But what I did love, actually, strangely enough, was retinal, which as an orthoptist, a lot of clinics, that means just you do a vision, you put drops in, and you send them on their way. With a lot of smaller clinics, and this is kind of what happened even at this large clinic in Queensland, is there's a lot of diagnostic testing, and it really is up to your testing whether or not the patient will then get the diagnosis and the care that they need. Also, even the way you communicate with the medicine board, Medicare here in Australia, to approve certain treatments will depend on your imaging, and sometimes very, very difficult to achieve. And I got to find that very early on, even as a student that hadn't really ever touched a machine like that before, I was actually quite good at communicating with the patient, setting up the patient, getting good results from the patient. Even though I wasn't very good at the actual machine skill, I was able to communicate really easily with the patients, even those with limited English. So that to me was a huge, like, okay, this is the thing for me. This is where I'm really, really good. And it encouraged me to kind of seek out that path. So these days, what I do is general ophthalmology. We do everything from glaucoma, which is a whole bunch of different images and testing and diagnostics, and then monitoring on those imaging diagnostic tests, so to see that the treatment that we've prescribed is working. And again, very important to get a good result, because otherwise we will never ever see progression, and most diseases we measure by progression. Once a month I do just a day of purely macular degeneration, and related things to macular degeneration. So sometimes it's vein occlusion, so eye strokes, things like that. So strokes that have happened inside the retina. Very, very trialing day, very, very busy, kind of, you know, it's hard to find the reward in a day like that, but I love it because I know that these patients have, you know, a regular place to come with a regular treatment to receive, and they just know the routine, and we've gotten to know each other, and they're so grateful, and I'm so grateful that we've got this treatment available to them. So that's been really, really amazing. And I, you know, as difficult as that day is and emotionally trialing as that day is, it's actually really wonderful from the perspective of, you know, really giving these patients that reassurance that when they see me there, they know that they're going to get the care they need. We're going to get the results we require. We're going to be able to track their progression properly. Like we've built a really great trust with a lot of these patients because they come back quite often. Some of them monthly, some of them 3 monthly. You know, and everything in between as well. It becomes more about how are their eyes going to serve them in their lives, as opposed to, you know, just come in for treatment, bang, 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 which is what they usually would get. So it's more personalized, it's more predictable, it's definitely emotionally more sound for them because, you know, patients who need extra drops get them, patients who don't like the drops, I prepare them, and so they, you know, more calm and more brave when it comes to drops. There's little things that you just customize for each patient to make them feel more secure and more comfortable about what's about to happen for them, and then they can have their treatment in a much more, you know, in a much nicer environment basically for them. And more recently, the most recent is glaucoma. So I've just had a couple of sessions so far with a glaucoma subspecialist. And that's interesting because I've been working with glaucoma for years, like basically since the very, very beginning. And this is the first time where I've seen glaucoma surgery and its progression properly. Because as a student in Queensland, I saw it for sure. But it was very choppy because, first of all, that was quite some years ago. Things have changed and progressed, number one. Number two, this time around, I'm seeing patients that I've seen for years under a general setting, and their disease has just progressed to the point where a general setting is no longer appropriate. So they've been then referred on. So I know the patient. I know where they used to be. I have an emotional connection, if you like, with these patients. I'm sort of definitely, aside from just treating them, I'm also you know, I'm also rooting for them to do well. They're not strangers anymore. I've known them for too long. And here they are seeing me with a different doctor. So I'm their only constant. And that has become very apparent. They're like, oh, tell me, is he good? What is he going to do? Can you help me? Is that the right choice? What do you think? Should I do this? Should I make this decision? Should I have this procedure? And frankly, I don't know. You know, it's up to the doctor to decide these things, not me, number one. And the other thing is, I don't really know yet. I've only worked with this doctor a handful of times, so you know, I'm not used to his outcomes yet. So it takes a while, not only for the patient to get used to a doctor, but also for me as a clinician. So luckily for me, I understand the actual procedures he's going to do. I can explain the procedure. I can explain why we're doing the procedure and what we hope to achieve. Also, what the point of referring them on in the first place is. Even though they've been told that this is why you're getting a referral and this is why we're putting you onto a different doctor, it's good to hear it again once they've come. Tell me again why I'm not seeing my regular doctor. Tell me again why I've had to move on and see someone new, because you're my constant and they're the new variable. And I'm able to do that for the patient, which is actually a really tricky, but also really, you know, I feel really blessed to be able to be that person for them, because these people are primarily elderly, and having that extra bit of reassurance actually makes a really big difference for them, which is lovely to be able to be the one that does. So as an orthoptist, you might work in pediatrics, you might work in surgical, you might work in general like I do. You might have a subspecialist that you work for, so you do a whole session of one type of disease and, you know, some little variables that come with it. So reality is not only do you treat eyes, but you treat the whole patient and the whole patient experience. That's what I feel that I specialize in. And that's mainly because the doctor I work with allows me to do that. It's a very small clinic. We're a team of 2. And, you know, I'm there to prepare the patient emotionally, informatively, diagnostically, imaging, with measurements, with all the things to see the doctor. So not only am I preparing results that the doctor will then use to help treat the patient and diagnose and, you know, measure progression and all that sort of stuff, but I'm also there to make sure that the patient is aware and informed and ready when they come through to doctor, so that, you know, there's less emotion, there's less fear. It's very scary because it is the kind of organ that people are always more anxious about. You know, it's an awkward kind of thing because you're talking about your potential sight loss. A lot of people come to me and say, am I going to go blind? And look, the short answer is yes, if you don't come back. You know, without treatment, you are definitely going blind, but we are at the stage in medicine where, thank goodness, we can make that endpoint of blindness go right away, decades away, for a lot of diseases. Not all diseases, unfortunately, but quite a few. So that's been really, really wonderful. In my time as an orthoptist, I've gone from, there's this new treatment, we can try it, you know, 80% of people get success, to, yep, we're doing this treatment, it's really great, let's try it because a lot of people are successful, let's try it for you. Lots of confidence. We went from, you know, wow, this is this new experimental, we're really excited about it drug, to, wow, we have this amazing treatment and don't worry about it, we'll just get you in tomorrow and start you on treatment and see how you progress. Like, totally different conversation from a clinician's point of view. From, oh, let's try something, let's experiment, to now, hey, we've got this thing and we've got you and we're going to do it for you and you're going to be much better, because a lot of people get much better. You know, definitely a different message that the patient is receiving from us as clinicians. And we've got choices now. You know, we've got so many options of how to treat people for so many different diseases, which we didn't have, you know, 10, 12 years ago when I first started. It was all very new back then. Even the imaging machines were pretty new back then. Now they're just, everybody has them. It's just the gold standard now. So definitely lucky to be working in a private clinic, to be working in Australia, to be working under a system that definitely affords a lot of people a lot of choices. I know that a lot of places around the world, not everyone can even afford the treatment. Even if they did need it, they really do have to choose whether they can afford to keep their sight, which is just a scary thing. I love that Australia, you don't have to have that choice. Worst case scenario, we can refer out to the public system, and they'll have to wait, obviously, and be uncomfortable for a period of time until they go through their waiting periods, but they will get their treatment, as opposed to countries where they may not. So if you know someone who's thinking of becoming an orthoptist, I definitely love orthoptics for me, because I get to do it fairly part-time. There are definitely weeks, like this week I'm going to do full-time, and actually probably more hours than full-time, but there are most weeks where I get to do it quite leisurely in the respect that emotionally it's draining. So having those breaks in between is great, where I get to go away and work on charity projects, spend time with my kids and all that sort of stuff. So definitely work-life balance, especially why I think it's very popular with women, a lot of younger women. It's the kind of thing where if you take a maternity break, you can get back into it part-time a lot of the time. It's got that flexibility. You're still in health, you're still in medicine, but you're not, you're a clinician, you're not a prescribing doctor, so you don't have that pressure of getting straight back into it. A lot of people, a lot of doctors are scared about losing their surgical lists or falling down in the ranks because of time off for whatever reason. Not the case here. You get someone to fill in for your maternity and then you come back when you're ready. Same thing with sick leave. Doctor can never be sick because who's going to see the patients? Whereas with me, as much as the doctor I work with prefers that I'm there over somebody else, there is still that option of somebody else if push came to shove. Being in the same place all the time is fantastic if that's something that you like to do, to really find a home away from home. I always joke, somewhere to leave your cup. But there are also ladies and gentlemen who opt to locum because you can earn more that way. So they just hop around different clinics and fill in, and that's their choice. Some really love surgical procedure, so they get to be really hands-on in the surgical procedure. Some become reps for the machines and the lenses that we use and the different technology that we use. So that's a career path as well. If you really love retinal like I do, and you get to do a lot of it, then that's really great, and I get to get really hands-on with the retinal, which is fantastic. It's not just vision and drops like a lot of clinics have it. I get to be really involved, which is lovely, so that's a really great path. Glaucoma is probably one that people like the least because there's a lot of really it's a very long journey, and it can be very hard to predict and things like that, so it's an interesting area of orthoptics. But it's interesting nonetheless, especially if I'm only doing it once a month. I get excited for it because it's something different. So that's really lovely. And for me, it's also because I'm lucky. I work with the most absolutely beautiful, genuine human being on earth as my boss and my friend. So we have a partnership, which is wonderful. And the other two doctors I work with far less. So I don't have such a close relationship with, but I can trust them. I can trust that when I talk to the patient and I promise certain things to the patient, it will be delivered. And I can go up to these doctors quite freely and say, look, I think this is what the patient is actually after. And have that conversation, have that relationship with them where they can trust me and I can trust them. And that's such a wonderful professional position to be in. And I also am lucky because I get to then go away and spend time with my kids and spend time on a different side of interest. So that's why orthoptics is great for me. And if you're interested in that kind of career path, or some young people who are choosing their paths at the moment, and orthoptics might be a good area for them, where you're with the machines, you're with the technology, you're at the forefront of medicine, but you are a clinician and you are a patient liaison in a way. So it's a really lovely position to be in a lot of different ways. Well, happy Orthoptics Awareness Week, everyone. I hope you enjoyed today's video. I hope you enjoyed the look as always, and don't forget to like and subscribe for more videos about eyes and about different things in my little world. I hope to be mixing it up a lot more this year, so please do subscribe to see what's popping up as the weeks go on. Check out Instagram for more regular updates and lots of cute pictures, lots of puppies and kids up there. And wherever you are in the world, lovelies, I hope you're having a wonderful time, and I can't wait to see you on the next one. Bye!